Hello everyone. Hi, this is Dr. Aviral Roy over here. Thank you so much for making it today. Health is the ultimate wealth. We'll be talking today on frozen shoulder, both the orthopedic or the doctor point of view on this topic, as well as with the which will be by Dr. Gaji Hassan, and from the physiotherapy aspect of it, which will be done by our physiotherapist Rion Das over here. I think we'll go ahead with the physiotherapy aspect of it from Rion Das. We're just having a little bit of technical issue, and we'll have Dr. Hassan follow up in the second half. Okay, and then as always, please put up your questions in the Q&A, and we'll go ahead with those questions and answers towards the end of the session. Rion, are you ready?
Yes.
Perfect. Okay, Rion. Please go ahead and start, and then we'll go with the orthopedician aspect on frozen shoulder. Thank you.
Okay. Good afternoon to everybody, and I'm so glad that all of you could join us for this webinar today. So today our topic is frozen shoulder. Right. So the purpose of this information that we are providing today is just to give you a brief understanding of the joint, the condition, and its treatment options. So I'll be speaking from the physical therapy point of view. Let's move to the next slide. Yes. So the shoulder joint, as we all know, it's as most of you might know, it involves the ball and the socket joint. But that's not the only joint that is in the shoulder. There are two other bones that we may not be aware of. Number one is the ball and the socket joint that we are already aware of. But it also involves the collarbone in the front, is called the clavicle, and also the shoulder blade at the back, which we call the scapula. So all these three bones and all these three joints must work together harmoniously to provide movement. Now, I'll give you a few more points about the shoulder joint. So as we discussed, the ball and the socket joint. The socket part of the shoulder joint. So this is the ball and this is the socket. So the socket part of the shoulder joint is not really that deep. It is a very shallow joint. And it's almost as if that it's flat. And we have the ball that slides over the flat surface. That is the ball in the socket joint. But unlike certain joints like the hip joint, it has a deeper socket. But the shoulder does not have that. Another aspect of the shoulder joint is, as we all know, it is designed to have a wide range of movement. We can almost move it in any angle we think of. And so in order for the shoulder to do that, it needs to be very flexible. And at the same time, it needs to be stable enough. So the shoulder depends a lot of its stability comes from the muscles that surround the shoulder joint. So there are four muscles that are mainly responsible for stability. It's called the rotator cuff muscles. I'm sure some of us might.
John, I don't think, just check if your slides are changing. I don't think your slides are changing as you're changing them. Okay, they're moving. Good.
Yeah, it's moving. Yeah, so the primary muscles that's responsible for stability is called rotator cuffs. There are four muscles, but apart from that, there are other four muscles that contribute to the stability of the shoulder joint as well. So as I already mentioned before, all these moving parts have to move together harmoniously for the joint to achieve the desirable range or wherever you want to move the hand in. Now we can see here, we have the ball and the socket joint. So notice the stick, the horizontal thin bone at the top. That is the collarbone, which is right in the front. And the flat triangular bone at the back, it is called the shoulder blade or the scapula. And of course, we have the ball and the socket joint. And you'll notice that the socket part is pretty flat. It is not concave as we think it is. Now, what is frozen shoulder? So I'm sure it's a quite common condition, and we must have experienced, or we might know someone who has had this condition. It is basically the shoulder joint is encapsulated in sort of a bag filled with fluid. It helps in the sliding of the joint, as well as it nourishes the joint as well. So this structure is called the joint capsule. Now what happens is the capsule gets inflamed, and then it tightens and it shrinks. So when that happens, when the joint shrinks, it gets inflamed, it starts producing pain in the patient. And as a result, the patient doesn't want to move the hand, and it furthermore restricts the joint. So it's like a circle. Due to the pain, the patient doesn't want to move the hand, and due to that, it stiffens the joint further. And it's like a never-ending loop that the patient is stuck in. Now, how common is it? So it is estimated that 20 out of 1,000 people will be affected by frozen shoulder every year. So that means it's quite a common condition. And it mainly affects 40 to 70-year-olds. So sort of in the midlife. Now, why does it occur? Now, frozen shoulder is primarily, you can divide it into two kinds. Let's call it primary frozen shoulder and secondary frozen shoulder. Now, primary frozen shoulder is patients that come with frozen shoulder who do not have any other physical conditions or any other physical problems. They come purely with the frozen shoulder. Now, the reason for primary frozen shoulder is idiopathic, meaning it is unknown. And I hope that maybe in the upcoming years we might know the cause, but till date, it's unknown. But secondary frozen shoulder, it occurs from various reasons. So you could have had, you might break your arm bone, and the doctor might ask you to keep your arm in a sling. So when that happens, you're not moving the arm around too much. And as a result, you might develop frozen shoulder in that arm. Certain surgeries, as you see mentioned here, like mastectomy and maybe like open heart surgery, these surgeries also have a tendency to produce frozen shoulder. And there are certain conditions like we see mentioned here: diabetes, heart disease, thyroid disease and Parkinson's, we see frozen shoulder commonly in these cases, in these patients as well. Now, moving on to the phases. Frozen shoulder is divided into 3 phases, as we see mentioned over here. Now, the first phase is the freezing phase. So what happens is the patient starts developing pain in one of the shoulders. It could be either one of them, or it could be both. But in this phase, in the freezing phase, the pain is quite a bit, but the patient still is able to move the hand. But due to the pain, the patient is in a lot of discomfort. And this particular phase lasts from 6 to 9 months. This is the freezing phase. Now, moving on to the frozen phase. In this phase, the pain is not that significant, but the patient, the stiffness is quite a lot. So as the name implies, frozen, the joint is the joint is frozen, but the pain is quite less during this phase. And the next phase is the thawing phase or the melting phase, in which the shoulder starts sort of to recover from whatever it has, from whatever position it was, it starts to recover. So that phase might take from 6 months to 2 years. So it can stretch to 2 years. So it's a pretty long time. Right. So the early signs, what are the early signs of frozen shoulder? Now, frozen shoulder usually starts with a very mild, it's very mild pain that might go away from over-the-counter painkillers or some like a hot pack. So it starts in a very subtle manner, and slowly as the days go by, it progresses into a more severe form. So it might interfere with a lot of your daily activities, with your daily chores, probably, and even something as simple as tucking in your shirt or wearing a pant might be difficult. Yes. So let's move on to the treatment. So the freezing phase, as I mentioned earlier, is the most painful phase of the frozen shoulder. So during this phase, our first emphasis is on pain relief. So in physiotherapy, we have a lot of ways that can help you with the pain. For example, we have electrotherapy like TENS and IFT. So these modalities, they help with reducing the pain. And as well as we use hot and cold as well to get the pain to a tolerable point. We can also depend on alternative therapy like dry needling, as we can see here. And of course, the doctor also prescribes the painkillers and anti-inflammatory or anti-spasm medication for the patient. So the important part about this phase is, in this phase, we do not do any sort of exercise. So it's mostly we ask the patient to keep the joint protected and to use whatever available range that the patient might have already. And that's very important. We must use whatever available range we have so the joint does not stiffen up further. Okay, let's go to the next. So during this phase, what should we avoid? So the first thing is, don't ignore the signs, because as I said, it starts off very mild. So a lot of us might think of, let me just take a painkiller and let me just go on with my day. So don't ignore the signs. Go to a doctor, go to a therapist, and have them check it out. It may not be frozen shoulder, but have them check it out at least. Next is a focus on proper posture, which is important. Because when a patient has a shoulder issue, a lot of the times, many of the time, you see the patient, usually they have a very improper posture. Either the patient is hunched over, or the scapula, the shoulder blades are all rounded, the shoulder is in a rounded manner, the patient hunches, or he walks in a stooped manner. It may not be uh, it may not be in all the cases, but a majority of the cases we see that patients with shoulder issues always have some sort of a postural issue. So I, during this painful phase or the freezing phase, what we advise the patient is, number one is do not sleep on the side affected. So let's say the right side is affected. So try to sleep on the left side and try to hug something with the upper arm, with the right arm, with the affected arm. Let's say a pillow. So try to keep that arm supported. Next is, don't try any forceful movements. Like if the arm isn't going to a particular range, don't try to force it yourself. You might injure the joint. So no forceful movement, no lifting heavy weights during this period, no sudden movements. Okay, you shouldn't jerk, and stop smoking and drinking, obviously. And don't ignore the diet, because a lot of the times in frozen shoulder, you see the inflammatory markers in the blood are high. So having a balanced diet is very important to keep those inflammatory markers low. So focus on your vegetables and a balanced diet, basically. Next is the frozen phase. Now, like I said before, the frozen phase may last from 4 to 12 months. We use hot and cold or both, something called a contrast bath. So I get a lot of question and a lot of confusion about when do we use hot and when do we use cold. So as a rule of thumb, we use cold when there is some sort of an inflammation in the joint. Either the joint feels warm to touch, or it appears red, or so when there's an inflammation, we use cold. Otherwise, we use hot. So you can sort of wrap the shoulder with if you're at home, with a hot towel, or let's say a hot water bag, whatever you have available. And of course, we have certain electrotherapies like ultrasound and IFT that help to decrease the pain and relax the muscles as well. We also, so this frozen phase, since it's a stiff phase, we focus on trying to get the joint back to its original range. So we focus on mobility. So there are certain exercises, like you must have encountered some of them, like a finger ladder or sliding your arm up a wall. So these are certain mobility exercises that that the therapist might prescribe to bring the shoulder back to its original condition. There are other ways that the therapist might help free your joint. There's a technique called mobilizations. There are different techniques called mobilizations in which the therapist sort of releases all the components of the shoulder. As I mentioned earlier, the shoulder is made up of 3 joints. So the therapist meticulously releases each joint and helps the joint rolling and gliding again. So that this entire thing is called mobilization, and there are different techniques to do that. There are other techniques as well. They're called muscle-based movements. So the therapist might use the available muscular range that you have to help the joint become free again. So the therapist uses whatever range is available to build on that. Yeah, there are certain equipments as well. I'll show you pictures at the end of the slide. So let's move on to the recovery phase. So when the patient reaches this phase, the stiffness and the pain starts gradually decreasing, and you get greater movement during this phase. So our goals during this phase is to maximize movement and improve strength. So you might ask that if the joint eventually recovers, what's the point of going through physiotherapy, because the joint will eventually get back to normal, isn't it? But a lot of the times we see that even after the recovery phase is over, the joint does not get back to its, there's certain restrictions still that we can see in the patient, or sometimes there's a lot of muscle wasting as well due to not moving the joint for a long time. There's a lot of muscle wasting that we see in the shoulder. So to prevent all these from happening, it is vital that we go to your nearest therapist and get your rehabilitation started. So here are certain exercises, certain common exercises that the therapist might prescribe. The first one is the pendulum exercises. I'm sure a lot of you might be aware of this. Next is twisting the arm outwards and inwards. So you take a stick and then you twist from your elbow and you twist the arm out and in, as we see here in the picture. Other exercises are taking the arm overhead. So if you're not able to move the arm independently, you can take the help of the other hand to move the arm. And you have twisting outwards. That is just simply taking your hand behind the back and sort of opening outwards and inwards. You can also kneel and try to stretch as much as you can to see how far does your shoulder go. So this is another way that you can help move your shoulder joints. And you have certain equipment like the shoulder pulley. We have the sliding board as well, where you might find this in your nearest physical therapy clinic, where you have to sit and you grab the sliding board and you slide your arm up and down. There's a thing called the shoulder wheel, in which it helps to move the joint in a circle. And of course, you have the finger ladder, which is quite common in a lot of places. There are certain towel stretches that you can also do. The first picture here is with a hand behind your back, and the hand on top pulls the hand below. So sort of like this. You pull the hand that's so basically in this picture, the top hand is pulling the bottom hand, right? And in the next picture, you see that the lady is stretching the hand backwards. It's called shoulder extension. So you can do that stretch as well. And the first exercise, you can do it vice versa. You can do it with both hands. These are pretty simple cross body reaches. Right. Next is the tips to help with recovery. What can we do to help the therapist or the doctor with the recovery? Because you must be an active part of the rehabilitation process. We should not blindly depend on the doctor and the therapist. We should actively participate in the rehab. So what are the important points that we can remember to make the recovery faster? Number one is maintain proper posture. Like I said, your posture while you sleep. Don't sleep on the affected side. Sleep on the opposite side with the arm hugging something or with the arm supported. Avoid lifting any heavy things. No forceful movement make sure the form is correct. Now, the therapist might give you certain exercises, but you must watch out for the form, because a lot of the times you may not be following the correct form. So a slight change in the form might not help you, or it might target some other muscle, which might harm you later in life. So form is important, and our body naturally tries to do things in an easier way. So we must do certain, if you're confused, or if you think that your form is not correct, have someone supervise you while you do the exercise. Next is use whatever range you have available. Like I said earlier, if you have, let's say, a 30 or 40 degree range, try to move your hand through that range, so you don't lose that as well. Next is make sure your therapist is qualified. So that's very important, because the shoulder joint is a complex joint, and it's very vital that the therapist that is treating you is qualified, so that you're not harmed. And follow your therapist's instructions. So what may be the frequently asked questions? I put certain questions down here, which I thought people might ask. So what are the associated impairments? I've already answered the first question. Let's move on to the second. So along with the shoulder,
Beyond us, we'll go ahead with the doctor aspect of it, with the orthopedician, and then can we come back to the FAQs?
sure, sir, sure.
In interest of time.
Yeah, sure.
Okay, so let's do this. Let us go through Dr. Hassan's question and presentation, and then we'll do the FAQs
Yes, sir.
in a joint manner. Perfect. Thank you. Okay, thank you, everyone. Thank you, Dr. Rion. That was an excellent presentation. Very, very thorough. Very, very comprehensive on what exactly is the physiotherapist perspective on the frozen shoulder. Because of technical reasons, I've got Dr. Hassan right over here, and he's going to give a presentation on the ophthalmology, the orthopedician's aspects to management of the frozen shoulder. Rion, can you just stop the screen share?
Yeah.
Thank you. Wonderful. Dr. Hassan, all yours.
Thank you. I would like to take this opportunity to thank Chairman Sir, Dr. Aviral Roy, Dr. Aviral Roy, and my mentor and guide, Dr. Bikash Kapoor. So, frozen shoulder, as from the name you understand that it's a condition where there is gradual loss of movement of the shoulder joint. That is, the shoulder becomes stiff and the joint becomes stuck and the mobility is gone. So as per the previous discussion, we already know that shoulder joint is made up of 3 bones: the collarbone, the shoulder blade, and the arm bone. And it has got excellent mobility, and it is surrounded by capsule and some important muscles which are important for its function. So how does the frozen shoulder happen? We have already discussed with Mr. Rion Das, who excellently showed the primary and secondary causes. Just for the repetition, the capsule that covers the shoulder joint becomes inflamed and it becomes stuck and adhere to the underlying bone. That causes the freezingness or the stiffness of the shoulder. That's why it's called frozen. Now, who gets the frozen shoulder? Person aged between 40 to 60 years are most commonly affected. Amongst them, most are females. individuals who has got a recent shoulder injury or history of some fractures causing immobilizer used in this treatment of the fracture. Also patient with diabetes or other health condition like thyroid disorders, stroke and Parkinsonism has got this propensity to develop frozen shoulder. Now coming to symptoms and signs, usually the patient presents with pain and then stiffness of the joint. Patient complains of difficulty in lifting the arm, inability to do day-to-day activities like wearing clothes or reaching for hip pocket. The stages already discussed, just for the repetitions, 3 stages. The freezing stage, when the pain is maximum, which might get worsened at night. Then there is frozen state, the shoulder becomes stiff, the pain lessens, but there is stiffness. And the thawing stage or melting stage or recovery stage, where the pain and stiffness gradually decreases and shoulder tries to recover, but depends on the treatment, whether the treatment has been taken or not. Now, how it is diagnosed? The primarily from the history and the examination. Your clinician will carefully listen to your history and examine you to see whether there is motion actively or passively. What the patient can do is the active motion, and what the clinician or physician is examining, that is the passive motion. And we sometimes order some investigation like X-ray, MRI, USG to see the status of the joint, status of the muscles and ligament inside the joint. Now there are treatment options already discussed. Hot and cold compression, the indication already discussed. I will not do repetitions. We prescribe medicines for relieving the pain. We also give injections. If it is not relieved by oral medications, we put the injection in the joint, or we first, after getting relief from the pain, we send the patient for physiotherapy. The exercises are started, and most patients do well with the exercise and the painkillers. This is the real and anatomic diagram showing the process of giving the injection. The needle is put inside the joint, either from the back or from the front. We give anti-inflammatory steroid injections to relieve that inflammation. If the inflammation goes off, there will be less pain inside the joint, and the patient will be able to do exercise properly. Now, exercises already discussed. The exercises mainly are of 2 types: the stretching exercises and the strengthening exercises. Stretching exercises are for the capsule to stretch out. The capsule already becomes thickened and get adhered to the underlying bone. Stretching exercise stretches the capsule and increase the mobility. These are the exercises already discussed here: the pendulum exercises, towel stretch, finger walk, cross body reach, and the armpit stretch exercises. Along with the stretching exercise, the individual has to do some strengthening exercises of the muscles surrounding the shoulder, especially the rotator cuff, the deltoid, and the periscapular muscles. We also the physiotherapist also do some form of release before starting for any kind of exercises. And electrotherapy is also important. TENS or IFT, they relieve the pain by blocking the painful nerve impulses coming from the joint. And lastly, if the patient is not responding to all the conservative modes of treatment like pain medication, exercises, injection, we do an MRI to see the status of the joint. We check the status of the muscles and ligaments around the shoulder. Then we opt for the surgery. We counsel the patient. We discuss about its merits and demerits. Then we do, where it is, we do minimally invasive arthroscopic surgery, where we do arthroscopic release of the stiff capsule and the surrounding ligaments. We release to obtain a pain-free, good range of motion for the patient. We use this arthroscope to see the inside of the joint, and we use this shaver to release all the contracted tissues, the capsule and the intra-articular ligaments, which are usually contracted because of the inflammation. This is the real picture. So in summary, frozen shoulder is a painful disabling condition. Early detection and diagnosis is mandatory for its successful outcome, and treatment depends on the stage of the disease and when it is diagnosed. And the role of exercise cannot be overemphasized. Thank you.
Thank you, Dr. Hassan. Rion, now I think will be a great time to go to your frequently asked questions so that we can get through a lot of the questions that are being asked in the chat box. And then accordingly, if there are any other further questions, we'll go through them. What do you think?
Yes. Okay, so let's start from the beginning. Why physiotherapy? Like doctor already mentioned, exercises are very important, but we also notice that this condition has a recovery phase, right? That means the joint starts to recover. So if it does recover, why do we need physiotherapy? Now, to answer that question, is the period in which the joint is immobile due to the pain and, let us say, stiffness. There's a lot of muscle wasting that happens of the joint. So when I say muscle wasting, I mean the body, when it doesn't use the muscle, it sort of shrinks, right? And gets weaker. So there are associated weakness of the shoulder joint, as well as even after the recovery phase, a lot of the times we see certain patients with certain amount of limitations that tend to carry on. So that's the reason why we opt for physiotherapy. No matter at what stage we are in, physiotherapy will always help you to get through the entire disease process faster. The next question is, what are the associated impairments? So like I said before, frozen shoulder comes secondary frozen shoulder. It also comes with a lot of postural issues. Let's say a rounded back, weak, with a weak upper back, probably a weak neck as well. So the pain in the shoulder might radiate upwards to your cervical, your neck region, and also it might radiate down to your low back as well. So these are the associated impairments, and of course your daily life is impaired as well. Your grooming or your dressing, even that's impaired. The next question is the treatment painful? Now, as we know that the joint starts to freeze. So any amount of freeing will require some amount of stress to the joint. So this process is a little, I wouldn't say it's painful, but I would say there is a little bit of a discomfort while the therapy is going on, especially when we try to mobilize the joint ourselves. So there is a little amount of discomfort, but it is always in the tolerable range of the patient. It is never excessive. The patient doesn't scream or yell. He might find it a little painful, which eventually goes away with icing or with a hot pack. The next question is, how long will it take to get better? So that this a lot of the time it depends on the age of the patient, and also at what stage did the patient come to you. So let us say the patient comes to us in the starting phase, in the freezing phase. So at that point, the recovery is faster because the joint is not stiff yet. So the recovery is faster. But let us say the patient comes to us when the joint is frozen already and there's not a lot of movement available. In that case, it might take longer. So the recovery time depends on the stage in which the patient comes to you. Will it get back to normal? Yes, it certainly does get back to normal. In my experience, of if there is if it's a pure frozen shoulder without any other problem, it does get back to normal. Some of you might ask, can we get massage done? That's quite a common question. So massage in no way does it help free the joint, but what it can do is relax the surrounding muscles, improve circulation, and probably give some sort of a psychological, comfort to the patient. So massage, if you want to get it done, you can get it done, but with respect to the joint, it does not do much to the joint, but it definitely will help around the joint to help relax the shoulder as a whole. So I guess, doctor, can we open the panel for questions?
Thank you so much, Rion. Wonderful presentation. I think your FAQs have actually answered like 90% of all questions that we need. So there are a bunch of questions over here. Number one is, unfortunately, I think the name has not turned up. It's only Mr. SDEOAE1E. He is an 80-year-old male. He had a frozen shoulder about 20 years ago. He plays golf regularly and has no shoulder pain as such. His main question is, what can he do as a preventive measure to avoid frozen shoulder? Let me ask this question to Dr. Hassan. Dr. Hassan, if you just answer this question, please.
As we have discussed the causes of frozen shoulder, the exact cause is sometimes not known if it is primary or idiopathic. But for prevention, one can do some restrictions like don't carry heavy weights on that particular shoulder, which is paining, which is inflamed, and maintaining proper posture during sitting or during walking, and see your physician or physiotherapist, whatever it is, as soon as possible whenever you are getting the pain. The pain always might not be due to frozen shoulder, maybe due to other conditions. We have to exclude it. So get yourself treated.
Perfect. Thank you, Dr. Hassan. So I guess a takeaway from the question is, don't automatically assume it is frozen shoulder just because you've had it once before. It could be something, it could be a repetitive stress injury. It could be some sort of inflammation. It could be a muscle or a tendon tear. So, make sure you see the doctor before you come to the diagnosis yourself. And most importantly, do not ignore persistent muscle pain, right? Okay, you had a pain, you were exercising, you have a little bit of pain, it goes, it's mild, 1 day, 2 days, probably okay. But if it's still persistent, it's getting worse, it's not really responding, you really should go ahead and see your doctor. I have one more question over here. This is from Mr. Datta. What are the basic daily exercises required to prevent frozen shoulder? I think I'll ask this question to Rion. Rion, what are some basic things that we can do to reduce our risk of getting a frozen shoulder?
Okay, to answer that question, I would not like
Rion, you're on mute.
Sorry. Hello, am I audible now?
I think you're fine.
Okay. So to answer that question, I would say the first basic exercise that you can do is range of motion exercises. So take your arm to its entire length. So you can do this movement, take your arm up, take your arm sideways, and also take your arm in and out. These are the rotational movements. Apart from that, I wouldn't want to get very technical with this, but frozen shoulder involves, a lot of the time it involves a weak back, a weak upper back. So like I said, the scapula is a part of the shoulder joint and it moves simultaneously when you move the arm. So a lot of the times, if you have a rounded back or a weak upper back and the scapula is not moving harmoniously with the arm, so that's called a scapular dyskinesia. That also affects the shoulder as well. So we need to give special attention to the upper back as well, mainly the scapular muscles. So you can do some sort of a shrug. So a shrug is you bring your shoulder backwards and upwards and hold for a few counts, let's say 10 counts, and then bring it back. So that's the shrug. So we do that to help strengthen the scapular muscles as well, or any sort of a pulling movement, let's say a row or with the therabands, that in turn also strengthens the upper back. So I would say number one, range of motion exercises and upper back exercises as well. That will help you with that.
Thank you, Rion, for an excellent demonstration. Rion, since you're a physiotherapist, you can help us out with just explaining to us. Can you just show us the various movements of the shoulder joint, as in what is a shoulder extension, flexion, internal rotation, external rotation? A lot of the exercises we saw said outward rotation, inward rotation. Can you just like do a demonstration for us as to what these movements exactly mean, so that when it's easier to understand or to see those pictures on the internet or in a book or in our illustrated material?
Sure. So first, this is called a shoulder flexion, in which the arm goes in front of the body and we lift it straight like this. So this is the front view and this is the side. So this is called a shoulder flexion. Next is shoulder extension, which is bringing the arm behind the back. So if you stand up, I'll see if I have space here. So if you stand up straight, you take the arm behind the back, and this is called a shoulder extension. So you start here and then you end up here. The next is external rotation. You can do it both ways. One is in neutral, when the arm is in neutral. That is, you can bring your hands up and then turn it outwards. So this is called an external rotation. And if you do the opposite, that's inwards, it's called an internal rotation. You can do that in this position as well. If this is the neutral posture, you can bring the arm upwards. This is called external rotation. And then you can bring the arm downwards, and it's called internal rotation. So these are the various movements that the shoulder joint has. There's another movement which is a little bit of a lift, which is called shoulder elevation. So you bring the shoulder to your ears and you bring it down. These are the movements of the shoulder.
Perfect, Rion. Thank you so much. And as all of you see, Rion really knows what he's talking about. Not is he only one of our best therapists. He also is a big gym aficionado. So, he knows his shoulder movements and more importantly, how to do them safely. Because like anything, it's not just enough to know how to do something, but how to do it safely with multiple heavy loads on it. I think we have our last question over here from Mr. Pavan. What is a good food to eat for a vegetarian? Interesting question. It's kind of I'm gonna send this to Rion, because Rion clearly knows what to eat. He knows how to do his high protein diets and take care of his muscles and his health. So Rion, why don't you tell us what's a good vegetarian diet for somebody who wants to work out on their muscles?
Okay, so what we might discuss here might be a little controversial, because a lot of the people have an assumption that vegetarian diet has low protein, that you don't get enough protein from a vegetarian diet. But I beg to differ. So you can get a lot of your protein from normal greens, and a lot of the Indian diet like dal and chana, green beans, they are rich in protein as well. So, and also the benefit of a vegetarian diet is it helps to keep the body in a more alkaline environment. I'm sure Dr. Roy, you might agree with this. So a lot of your your inflammatory markers when you're a vegetarian are low. So I'm a non-vegetarian myself, but so a vegetarian diet is good. It helps to keep the body alkaline. It keeps the inflammatory markers low, and you can get in a lot of your protein from your chanas, your dal, and your greens. There's an abundant supply of protein-rich food. Even broccoli. Broccoli has a huge amount of protein. So I hope that answers the question.
Perfect. Perfect, Rion. So I guess, there's a saying in English, right? As strong as an ox. So clearly we agree that an ox or a buffalo is really strong. And guess what? They're all vegetarian, right? You'll never see an ox or a buffalo eating meat, right? So the importance is that it is a question of how much protein you eat. It is a question of the right mixture of proteins that you're eating. So as Rion said, you need to have your dals, you need to have your chana, you need to have your rajma. Soya bean is a great source of protein. You need to mix up your source of proteins, because while they're great source of protein, there's certain amino acids they lack. So, but if you get the mixture of them, then you get all the amino acids. And then, like an ox, you could be really, really strong and you need to exercise. But otherwise, that all that protein that you eat is just coming out in your urine. So it's not only a question of eating strong and eating healthy, but also exercising your muscles appropriately to make sure they're strengthened and they don't necessarily get inflamed easily. Perfect. Thank you, Dr. Hassan. Thank you, Rion, for your wonderful presentations. And we hope to see you soon. Thank you so much to our audience for such wonderful questions and for listening and for bearing with us and our technical issues in the first few minutes. We hope to see you again next week. Please remember, Health is the Ultimate Wealth presents every day, every week, every Saturday from 5:30 p.m. to 6:30 p.m. Till we see you next time. Thank you. Have a good evening. Have a good evening and a great weekend. Thank you, everyone.